After a fire in April and an initial promise that the hospital will reopen in 7 days, 2 months later, Charlotte Maxeke is expected to partially reopen today. The hospital's closure could not have come at a worse time, placing further strain on Gauteng's healthcare system, battling a third wave. Well, let's get more information on what that partial reopening actually means. We cross to our reporter, Maxeke Hospital. Thank you so much, Maxeke. What's actually going on today at Charlotte Maxeke?
Well, Annika, after about a 2-month closure of especially the radiation oncology department here at Charlotte Maxeke, it's finally good news for cancer patients because they will be able to come here. But what we need to make clear also, Annika, is that you can only come here on appointment because they're trying to avoid people coming here in large numbers. Besides the COVID-19 regulations and protocols, reasons behind that, it's also to make sure that you receive services that you come here for, so that you're not turned back. So I think what's important is to let the viewers know that. But as you can see behind me, that is the entrance for that radiation oncology department. We did see some patients coming in and they are being attended to. A lot of them had to get services for cancer at the Chris Hani Baragwanath Hospital in Soweto or the Steve Biko Hospital in the city of Tshwane. And of course, there was pressure mounting on those two facilities. So the reopening of this department here at Charlotte Maxeke comes as a huge relief. But also, the president speaking yesterday about the importance of this hospital. You might remember that it was one of the 5 main hospitals that were named by the former MEC Bandile Masuku to deal with COVID-19 when we first started battling the epidemic here in South Africa. So it's a very important hospital in the fight against COVID-19. But I do have with me the CEO of the hospital, Maxeke Hospital. Thank you very much, CEO, for your time. Now, of course, just tell us what's been going on this morning, how things have been going inside with patients after reopening today. Are there any teething issues?
Good morning and to the listeners, and good morning to the community at large. First of all, let me say that we thank all the partners that assisted us to open radiation oncology today. Today we booked 13 patients, and so far at about 9:30, we already had 9 who had arrived, so we are still waiting for another 4. Things are going well, because these are the patients that had already started treatment. Some of them were the ones that were going to Steve Biko, and so we have recalled a few of them because we also do not want to take everybody there while the other patients are at home. So we are very elated today, and the doctors will review them again so that they can decide the type of treatment that they are going to come. I'm told that 9 of them or 10 are coming for the treatment on the LINAC machine, while the others are coming for bracket treatment. So we will see at the end of the day, review how the day went to see whether we should increase the numbers, and if so, by how much.
Now, CEO, there's also, of course, the important issue of the fact that the viewers must also know that the emergency department, as said by the spokesperson of the Gauteng Health Department, Kwarakagana, earlier, has not been opened yet. So that's also very important to say. And that would mean that Charlotte Maxeke is not completely ready to receive COVID-19 patients. But I do believe that you do have staff members across various facilities across Gauteng to assist. Can you tell us more about that?
No, thank you very much for this. I can't stress more than what the communications people have said. The hospital is not open for any other thing except for radiation oncology. Those who are coming to radiation oncology will be called by the doctors or the nurses or the drugs, and they will then tell them on which day to come. The rest of the other people, wherever you were, where you were collecting your medication or attending your treatment, you need to continue going there. Now, in terms of our staff where they are, we have responded to COVID-19, assisting the other hospitals. As an example, the ABT structure at Bara, we have already opened 115 wards, the one being opened on Saturday, a 23-bedded ward. And as I'm talking now, they are trying to open another 23-bed at that ABT so that we continuously increase the number of beds that we are responding. 90% of the staff at that ABT come from Charlotte, and Bara has augmented, and I know the SNDF and other people are going to try and beef up so that all the beds that are available at that ABT can be utilized for ABT. The second hospital that we strengthened, especially for Ekurhuleni, is Bertha Grower Hospital. Our staff have assisted majority of them to open 120 medical beds where COVID-19 patients are admitted. But we have also assisted them to open a 14-bedded high care and a 10-bedded ICU, which is run completely by our staff with a few from Bertha Grower. And the third hospital that we tried to strengthen was Helen Joseph. They have a 23-bedded ICU for different activities, some for patients who are coming for general problems, health problems, while the other beds are being used for COVID-19 ICU beds. So what we have done is that because majority of our patients who were at Steve Biko needing critical care, where Steve Biko took over and we have reduced elective surgery, we moved that staff from Steve Biko and they have strengthened Helen Joseph to be able to run all those 23 ICU beds. The last hospital that we strengthened is that we had staff that was moved to Leratong Hospital, and so when the patients were discharged, the original ones, we did not recall the staff. And so that assisted Leratong to open a 20-bedded ward, which is mainly run by our staff, but together with being augmented by Leratong. In all other hospitals, the rest, which is about 10 of them, our staff is still there. They are assisting to respond to COVID-19 in whichever way they can. For example, in casualties, some of them may be in general wards, but also at Tara, which is a psychiatric hospital, because as you know, the mental health patients, it's even more difficult to run them. So they have converted their wards into COVID wards. And just as an example, on Saturday, because it's not a hospital that keeps oxygen all the time, we are supplying them with the oxygen cylinders to ensure that those patients who are at Tara are well looked after all the time.
CEO, I know that this might be a question that you can't really answer, but have you gotten any report on your desk from DID or whoever was investigating this fire? Do we not know yet what the cause was?
Not yet. We have not been informed about that.
Okay, CEO, thank you so much for your time. That is, of course, Gladys Bukhoshi, the CEO of the Charlotte Maxeke Academic Hospital. As you can see, very good news. You heard from her all those hospitals that the staff members who worked here have been transferred to be able to assist, especially with COVID-19. Gauteng, for instance, eNCA is recording on a daily basis now almost 12,000 new infections per 24-hour period. So I think this is good news for the province, and hopefully soon, once the hospital has reopened fully, even for COVID-19 patients, that will be even more relief for the province.
Maxeke, are you getting any definite timeline on when the rest of the hospital can open?
Well, we don't have a timeline yet. As you know, eNCA, the issue here is that it's a multidisciplinary or rather multi-departmental issue. So it's not only the health department that's dealing with the reopening of the Charlotte Maxeke Academic Hospital. There's also the Department of Infrastructure Development that is involved. There is also the fire department that was also investigating the cause, was investigating whether or not they'd be able to rebuild that section or even save it, or what should happen. So it's quite a long process, and you'd remember that there was all those talks after the Premier visited here after that almost 24-hour fire. He came here and he said the hospital would be closed for 7 days, and that caused a lot of confusion because, of course, that couldn't happen. It was quite a devastating fire. It lasted for almost 24 hours. So we don't know yet exactly when the hospital will be fully operational. We spoke to Kwarakekana earlier on of the Department of Health, and she was telling us that they would be communicating with the public through us as the media to be able to say exactly when everything will start being fully operational. But for now, it's not safe yet.
Thank you, Maxeke, who's at the Charlotte Maxeke. And just to be absolutely clear, only those coming in for radiation oncology can come to the hospital from now on, and they have to do so on an appointment basis. So while it's great that the cancer department, the oncology department has reopened, there are still at least 300 high care and ICU beds that are not open at the hospital. It is just one section of the hospital, and we understand that FNB actually stepped in to make sure that the oncology department could open, so thank you to them.